Here in France, nightclubs are to close for 4 weeks from this Friday as part of newly announced measures aimed at curbing the current rise in COVID cases. Stricter social distancing measures are also on the way for schools, and authorities are aiming to start offering vaccines to all children aged between 5 and 11 from the 20th of December. People are also being urged to consider working from home for 2 to 3 days per week where possible. Speaking at a press briefing a short time ago, Prime Minister Jean Castex said that with close to 90% of people now vaccinated, the government was holding off on imposing stricter measures on the general population.
If the number of cases increases, it's not the same situation that we were in last year. The French are vaccinated far and wide. It's the case of 52 million among us. And that changes things. Without vaccination, our hospitals would already be reaching their maximum capacity or be oversaturated, in the same way that we saw it happen in the first wave a year ago. Lockdown measures will be taken into account, like other European nations. But it's not needed today, and we hope that it won't be tomorrow.
Well, for more, we can speak now with epidemiologist Catherine Hill, researcher at the Institute of Cancerology at Gustave Roussy. Catherine, these new measures announced a short time ago, will they go far enough, do you think? Are hospitals here in France going to be able to cope with a predicted surge in cases over the winter?
I'm not sure. I really think they are very mild measures. The number of new admissions in intensive care units is increasing by 3% per day. So it's really a very rapid surge. And I think those measures that have been announced are not strong enough to avoid saturation of the hospitals. And the hospitals are in a very, very bad shape. Lots of nurses have given up working in public hospitals, and they are very, very short-staffed. So it's going to be very difficult, I think.
And what kind of measures would you have liked to see the government introducing? We're already seeing countries like Germany and Italy toughening up on people who aren't vaccinated. Do you think that COVID mandates are something that we need here in France?
Probably, yes, because there are still more than 5 million individuals older than 11 who could be vaccinated and have not been vaccinated, including a fair number of people aged over 80. Among them, 13% of those are not vaccinated. And the vaccination at home of people who are not very mobile has not been organized. And that's really a problem.
And we can see the government now, they're also aiming at introducing vaccines for children aged between 5 and 11. And we're seeing a lot of cases in schools here in France. So how effective do you think that particular measure is going to be?
Well, it depends how acceptable it is by the population. And I have the impression that a lot of parents are not ready to bring their children to be vaccinated. And the number of cases, the number of positive children is increasing because they are tested more, but they are not ill. COVID-19 is really not much of a problem among children. So they have to be vaccinated to protect others. It's an altruistic decision. And I'm not sure the parents are really willing to do that.
So
we shall see.
And Catherine, we're entering a fifth wave here in France. Do you think that we're going to see a kind of a stop-start system indefinitely with new measures being needed with each new wave of COVID?
I don't know. I hope we will at one point have a reasonable strategy with massive testing of the population and isolating the cases that are found positive before they show with symptoms.
Okay, Catherine.
We are very far from that.
Catherine Hill, thank you so much for joining us this evening. That's Catherine Hill, researcher at the Institute of Cancerology at Gustave Roussy. Well, describing it as the